The program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, Mercy Medical Center, and of course, our socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and our guests are Dr. Ahmed Sabe, Executive Director of the Heart Hospital at Mercy Medical Center, and Daniel Harvey, Physician Assistant at Mercy Cardiovascular Institute. Good morning, Dr. Sabi. Glad to have you back. And Daniel, and welcome to the show.
Morning. Thanks for having us.
Very early in the pandemic, it was clear that many patients who were hospitalized were showing evidence of cardiac injury. Nearly 30% of those hospitalized with COVID-19 have been diagnosed with a cardiovascular complication, which have been shown to contribute to roughly 40% of all COVID-19 related deaths. Two recent studies suggest heart damage among those infected may be more widespread. This morning, we're going to talk with Dr. Sabe about concerns for damage as a result of COVID-19. We'd like to remind our listeners that our program is available on our podcast, so you can use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
So, Dr. Sabe, again, it's great to have you back. You've been on several times in the past. And tell us a little bit about yourself for our listeners and introduce yourself to our listeners also.
If some of the listeners don't know me, I've been, almost every year. This year I exceeded 1,000. I touch at least 1,000 patients every year to their heart in the cardiac cath lab. For now, how long? More than 20 years in the Stark County. So if somebody is so lucky that he did not have a heart problem here, I can tell him I am a heart doctor specialized into unplugging your coronaries. We call it intervention cardiologist. Our specialty is quite interesting because I deal with number one killer in the whole world is heart disease. I was trained during my trip in the training. I was in the Texas Heart in Houston. I was at Mass General in Harvard. I was in teaching for years, running a whole intervention program at Penn State University. And I've been working for the system here, for the sisters for 24 years, build a heart service line. The doctors and the hospitals, nurses, technician, assistants, all under one umbrella. And we compete against the heart disease. We're not competing with anybody else. The competition is mainly heart attack, heart disease, sudden death. And our target is to keep our patient out of the hospital. Get all the physician. So if we see a patient, if we see you as outpatient in our clinic, and if you come to the hospital, we come to see you and find out what can we do next time to avoid you coming to the hospital. Our target is to keep our community healthy. We want you to be at home healthy. That's the right way. Every patient who comes to us for the heart disease, we tell them, how can you avoid heart attack? We need to educate them about the exercise, the stress, rehab, all of this. That's really who we are. And personally, that's who I am. And that's why I match it very well with the mission of the sisters. And I am hoping very well from what I know, that's the target of the incoming owner, the new owner of Mercy will be the Cleveland Clinic. We are here to make an impact in the community. We want everyone who's listening to me, you and everybody, to be healthy at home.
Okay, how about Daniel? Welcome to the show, Daniel. I don't think you've ever been on before with us.
I have not. No,
I think
that is correct.
And Dr. Sabi's been on about 12 or 15 times. I think we always learn something new from him.
Yeah.
So tell us a little about yourself and introduce yourself to our listeners.
Sure. My name is Dan Harvey. I've been a PA since 2003. I got my master's degree at AT Still University in Arizona. I've been at Mercy for over 25 years in one form or another. Since a PA, I've had 14 years of ER experience, and in the last 3 years, I've worked with the cardiology department here at Mercy Cardiovascular Institute, the heart hospital. As PAs and NPs, we are really integral as part of the healthcare team, all the way from physicians through the nursing staff, the MAs in the office, operators. It's a global process. It takes an entire team to care for the patient. And we're very proud and honored to be able to serve the community in the capacity that we do.
Okay. So what telehealth strategies are available to address patient concerns with COVID-19?
Anybody?
Yeah, go ahead, sure.
Well, telehealth actually has been in the back burner for quite a few years. Because remember, if I was just mentioning, my target is to keep you healthy at home. So the less time to ask you even to come to a trip to see the doctor in the office, it would be better. If we can achieve the optimum telehealth, it will reflect great on the community. And today with the COVID, when COVID comes, there is bad and good and quite few things in the middle. So one of the good things about COVID is the telemedicine start to move faster. So we have it available for our patient to avoid coming exposed to other patients with COVID. So if we try to communicate with our patient, gives them the option. There is some patient who wanted to be seen in the office. We have this available, and we space the office enough that we will protect them if they come to us. But telemedicine is one positive thing came from COVID, in my personal opinion. The more, because if I care about your health, if you come to me with heart attack, I need you to go to cardiac rehab, and the cardiac rehab will tell you what to exercise, how to exercise, what kind of activity you have to do, what kind of food you have to do. And most of the patients don't join this because it's a trip. So if I use the telemedicine to make more patients be part of the rehab, I will succeed amazingly to do what I wanted to do, the health of the community. There is so many potentials for telehealth, and we are trying to move as fast as possible. And that's one thing I'm so excited about it, because the partnership of the Cleveland Clinic with Apex, with Google, they have like dream come true. When I try to see what they are planning to do, I think our telemedicine will go like in a places only was in our dreams a few years ago.
Yeah.
Interesting.
Brad, can I also interject? One thing with our nursing home patients, we don't want them leaving nursing homes unnecessarily. And we're routinely doing telehealth visits virtually to the nursing homes, just to make sure that the patients are getting the cardiac care that they need. That's an important thing with our elderly population is, controlling high blood pressure, heart disease, all these things, because if they do get sick with COVID-19 and their other comorbidities such as heart disease, et cetera, is not being managed, the outcome is more likely to be negative. And we like to intervene early as opposed to being reactive to them when they have to come into the hospital. So telehealth does have a place in our practice.
And under the leadership of Dan, we launch a very unique program to link us to our heart patient 24/7. So the heart patient who come to Mercy Cardiac Institution has the ability to question any of us, his heart doctor, 24/7. Log in, send your message, and through the 24/7, there was always some nurse practitioner, some of Harvey with Dan Troop will be awake. We have people on call here 24/7. They will get the message and contact the doctor and get the patient answer to avoid getting him to somebody who doesn't know his case, which most of the time, oh, you're sick, come to the hospital. You're sick, come to the hospital for the even medical legal responsibility. And that's unique. This is a program, never heard about it anywhere. And that's something when the Cleveland Clinic comes, you look at innovation. So we can share with them part of what we did here in this community to keep our patient. It's part of the telemedicine.
Very interesting. So in the nursing home, they take a laptop around each patient or that you have in that home and you just talk with them, or how do we do this?
A lot of times what we're doing now is just phone calls. Okay. We'll talk to the patient, we'll talk to the nurse, we'll get vital signs. We'll ask the patient how they're doing. The nurse will review the medicines with us, and then we'll adjust things as necessary. Not everybody in our practice is set up with the video portion of that, but certainly telemedicine by phone is an easy option.
Okay. Well, I think we'll take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't, our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for staff care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy. Yes, we are open. We are open. The Medicine Center Pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing how COVID-19 affects the heart with Dr. Ahmed Sabe and Daniel Harvey, physician assistant from the Heart Hospital at Mercy. So, Doctor, tell us about the concerns you have for older adults and cardiovascular disease as it relates to COVID-19.
Well, there is information's come about COVID every week because we try to know more about this pandemic, sometimes daily. The idea initially it was thought to be like infectious, like pneumonia. And then later on, they find out that it really affects the endothelium lining of the small arteries and the veins. And this resulted in some sort of clots, thrombosis. So that changes the thought initially it's infection turned it to be some sort of infarction, like part of the vessels are clotted and the tissue around it is dying. And interesting enough, it can do the same for the heart patient. So we can get patient with what look like a heart attack, and take them to the heart cath lab, and the big arteries of the coronaries looks okay, but yet they have micro damage because there is a small clots in a small vessels. So having that's what mainly happen. It can also affect the myocardium, endothelium, and cause weakness of the whole heart. So inflammation, we call it myocarditis from COVID, and the heart will fail. And that's actually, the mortality is so high when it gets that bad. But to get back to your question, the older age is a higher risk for getting into trouble with COVID. Why? Because it's a fight between the invasion of the virus and the body immunity. And when your immunity is low, the chance for the virus to invade your body and win the game is much higher. So if we look at the elements which reduce the immunity, having diabetes mellitus, having a heart failure, having a comorbid condition affect your immunity. Having stress affect your immunity too. You know, there is multiple elements, and that's why the outcome is so variable. There is patient who gets the infection and wouldn't even know that he got it, and some people succumb from it. The share of the heart problem comes when there is a thrombus, clotting in the small vessels, sometimes clotting in a big vessel, and that's we deal with, opens artery, and there's a problem with myocardium weakness. So you get into inflammation of the myocardium, so the heart will not be able to contract, heart failure.
So, Doctor, what about the QT monitoring considerations for hydroxychloroquine and azithromycin use in COVID-19? I mean, I thought I heard yesterday some renewed usefulness of this product or something. Did I? Or
well, there is some in certain parts of the world. There is physicians who believe it does something. I just was communicating, you know, now with telemedicine, we log in and hear from our colleagues from all over the world. There is some believe it make a difference. There is no scientific data to prove this. The scientific data did not show much difference if you take chloroquine or not. But chloroquine is one of tons of medication known to affect the electricity of the heart. The long QT is simply, it increases the time when the myocardium is vulnerable. Was very fast heartbeat, which can make you lose conscious and require cardioversion if you are in the hospital, or result in sudden death if you are away from the hospital. So it's a matter of risk and the benefit. If the benefit is not beyond the doubt proven, does it worth it to take the risk? And that's a question. Actually, the Canadian just got their data maybe 2 days ago. They were also, because it's inflammation of the endothelium, so they were using anti-inflammatory colchicine into this patient. One study is out say there is a tendency to make some difference, but another place in Canada, I think in McMaster, they try to compare aspirin, no aspirin, colchicine, no colchicine. There is so many trials try to tackle how to solve this issue. In my personal opinion, and hopefully this will be coming, there will be a pill, antiviral. Once you get the diagnosis, take it every day for about a week and control this disease. And there is trials trying to do this. You know, they were able to have these pills, but it's forever for HIV. It's not like this. The viral is different than the HIV virus. So if they get the antiviral pill, it will be only probably a week or 10 days of this treatment. There is a light in the end of the road. But everything we have today, in my opinion, which I'm a cardiologist, but they call COVIDologist now. Some people see so much COVID in areas where in New York and Boston, and they call it COVIDologist. I think blood thinner is very important if you are in the hospital, because we know it clots the small arteries, and the steroids because it's anti-inflammatory and it can help. There is so many other things, but there is at least 2 so far, to some extent, established as a line of management once the patient get hospitalized.
Yeah.
Try to see if you get COVID, shall I put you blood thinner, send you home? There is trials going on today to see the risk and the benefit. Because if you are home at blood thinner, there is problem with bleeding. So they are trying to make this trial to see, but for outpatient blood thinner, it's not a standard today. But very much every patient comes with COVID, they try to give him a blood thinner to help.
Yeah, Paul, going along that same line, I know hydroxychloroquine has kind of fallen out of the limelight here a little bit, but the FDA has approved Remdesseviere, which we're giving IV, which should help shorten the duration of the illness. But this also it's a newer medication, and we don't know all the interactions that it has. As a matter of fact, just a week ago, I had a patient in the ICU who was getting Remdesseviere and was also on an antiarrhythmic medicine for atrial fibrillation. And we noticed that the patient started having these QT issues. So we did some further research and realized that they do use the same metabolic substrate to break them down and to be metabolized. So we had to adjust their antiarrhythmic medication while they were getting the antiviral, because clinically it's probably very important that they get the antiviral to survive the COVID illness, and then we can adjust their medicine after that, in which we did, and the patient seemed to do very well with that. So, some of these newer medicines, we don't know all the interactions we're going to have with them yet, and just like hydroxychloroquine, we'll see how Remdesseviere pans out with this.
Sure. Okay, bottom of the hour time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, Sunday and Monday could be a bit snowy. AccuWeather says we could see anywhere from 3 to 6 inches of snow starting Sunday morning, lasting through Monday afternoon. At least 6 people are dead. 11 others have been hospitalized after a hazmat situation at a poultry plant in Gainesville, Georgia. Among those transported, 4 firefighters. No one is sure exactly how it happened, but authorities say there was a leak in a liquid nitrogen line. Pioneering actress Cicely Tyson has passed away at the age of 96. She was the first black person to have continuing role in a network TV series and the first black woman to win a Lead Actress Emmy Award. She was also the oldest person to win a Best Actress Tony Award at the age of 88. General Motors is the latest automaker to announce a plan to go all electric. The company unveiling a long-term plan that would end the production of all gas-powered vehicles by the year 2035, replaced by all-electric cars, trucks, and SUVs. More news coming up at 10 o'clock. I'm Pam Cook.
The 10K payday word of the day is
Voice. V-O-I-C-E. Voice.
10K payday. Go now to WHBC.com and submit the word for your chance to win. Get those bonus entries too. The 10K payday.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. Partly cloudy this afternoon, couple of flurries, high 27. Partly cloudy tonight, low 17. And tomorrow we'll have periods of clouds and sunshine, high on Saturday, 31. Periods of snow Sunday, accumulating an inch or two with a high of 32. Very cloudy and chilly on Monday with snow showers, accumulating up to 6 inches, high 30. I'm Holly Holdren for News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Hey, we are back. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing cardiac care at the Heart Hospital at Mercy Medical Center. Before us, we have Dr. Ahmed Sabe and Daniel Harvey, physician assistant. Let's get back to the show.
Okay, so let's assume that we have a patient in the workplace that has cardiovascular disease of some type already. How do you recommend that they manage their exposure to COVID-19 in the workplace?
So every patient should take into their own health considerations of what their comorbidities are, and if they feel that they're more susceptible to having a bad outcome from COVID-19, it's like they have high blood pressure, heart disease, these kind of things, then they have to consider the workplace that they're actually working within and assess their risk. Now, they can work with their physicians and have a good discussion and explain to the physicians where what they do, what their environment is, and then get a better plan in place, because everybody's workplace is different. You know, here at the hospital, it's one way. At a factory, it may be another way. You know, one thing, you know, some of the things that are obvious common sense things, you know, minimizing face-to-face contact when you can avoid it, you know, social distancing, wearing a mask, workplace sanitation, hand hygiene, you know, don't touch your face, these kind of things. And then you can also think some places can put up partitions or barriers where it could be useful or even beneficial. And then ultimately, you know, avoid big gatherings. If you're having meetings, try to do them virtually, just like we're doing here. You know, we're not getting together face to face, but we're certainly having a good conversation. And I think meetings can be held in the future by virtual means much more readily now. So.
Okay. How do you manage and what is AMI during COVID-19?
Good. Am I on?
Yeah, you're on.
Well, let me just tell for the workplace. I will extend this to your home too, because American Heart Association, American College of Cardiology, and the European Heart Association make their commitment just recent that we have to be aware of a major risk factor for cardiovascular disease, and we will get for that matter the infectious diseases with COVID, with whatever respiratory infection, is the air pollution. So it's a really serious matter for whole world. The people, and if we are going to get into the preventive medicine for our patient, it will be part of us as a healthcare provider to educate our patient about simple things. You know, you go to your home or a workplace, we have to be sure there is an up-to-date filter with a good filtering of those small particles. At your office, at your home, it's advisable, even if it is too cold, to just open a window a little bit for a fresh air to come to your workplace, to your home. There is a bunch of data will hit the scientific research because they are opening the gate for all kinds of research about the pollution, because I think it's now number 4 as a cause of the mortalities. It starts to be high up, closer to smoking and hypertension. So as long as we talk about the air and the aeration, it's very important to keep this in mind. That's all. Get back to your question. You asked about, I forgot. What did you ask about?
AMI. What is AMI, and how does that, how do you manage that during COVID-19?
Well, the acute myocardial infarction is when the part of the heart muscle is dying because there is no enough oxygen going to the muscle. Traditionally, the most common cause for this is a big artery one of the coronary arteries is shut closed. Why is this happen? Because you have high cholesterol, high blood pressure, you smoke, you have diabetes, you have a family history of coronary artery disease, and you have plaque inside the artery. And with the blood going through back and forth, all of a sudden the plaque rupture and the artery shut close. Now the muscle will not get oxygen. Now you have the heart attack. So the most common reason for the heart attack is a big artery, one of the coronaries shut close, and we treat this in COVID or non-COVID the same. We still have the cath lab inside the emergency room, the only hospital in the nation, to my knowledge, who can open the coronary artery within few minutes. So if somebody coming with ST elevation, look like the muscle is in the middle of heart attack, we activate our system. So the patient will come from the ambulance to the ED cath lab. And within minutes, we are there at the coronary, unplug the artery. Sometimes, especially with COVID, the changes on the electrocardiogram will not be that impressive because it's not a big artery clot. It's a small arteries having clots. And those patients, we prefer to just give them like simple blood thinners and handle this. If clearly look like a big artery clotted, no difference. And our cath lab in the emergency room is actually prepared for this. It has negative pressure. So when the patient is in a cath lab, there is no possibility of the air circulating in the rest of the emergency room. It's a negative pressure. And we take the protections and open the artery. Matter of fact, we take the protections all the time until patient proven to be non-COVID or COVID, to protect our health caregivers. You know, we in our team, me, Dan, our nurses, we are all the caregivers. We are all equal when we come to against our competitor is the heart attack. We all come together and do this. But that's what we do with acute coronary syndrome, acute myocardial infarction.
What about hypertension? Is there a link between hypertension and COVID-19?
Well, I have my opinion, and Dan will get you what is published. But I can tell you, you know that about if you look at the United States, they will say 125 million have the cardiovascular disease. My God, almost half of the population have cardiovascular disease. What do you mean about cardiovascular disease? My answer is it's a hypertension and coronary artery disease, heart attacks, and stroke and heart failure. If you take hypertension out, the percentage go only to 10% of United States population. Hypertension is huge. there is almost 40% of the patient who live in this country have high blood pressure. So it's not a surprise that some patients come with COVID will have a high blood pressure. They try to make it a causal effect, and to my knowledge, it never proven to either one cause the other. So when the patient has and he has some sort of hypertension, maybe pressure goes up. There was a question about some of the medication we use for blood pressure has something to do with the mechanism of how the virus get into the cells. And we don't change antihypertensive medications because of the patient having COVID. We try to control the pressure as we do with every other patient. And get back to that.
Yeah. So initially, when this first kicked off, like New York and Wuhan and parts of Italy were reporting up to 50%, 56% of the patients with COVID also had comorbid disease of hypertension. And right now on the CDC website, hypertension is listed as with 20% of the patients who have succumbed to the illness, and it's only second to pneumonia and influenza as a comorbid disease when they pass. And as Dr. Sabe was saying, hypertension still, it's the number one modifiable risk for atherosclerotic cardiovascular disease, and it just needs to be managed. These patients who come in with hypertension are already behind the power curve as far as, they've already got the COVID to fight, and then we're not completely sure what the connection is between hypertension and mortality is, but we do know that it is related. It's just not a causal link between hypertension and COVID-19. So if that makes sense.
How do I use the 24/7 line as an MCI patient to address my concerns or questions?
So there's on the MercyNet website, cantonmercy.org, under the Mercy Cardiovascular Institute tab, there is a form. It's a short form to fill out. And it really just asks for your name, your last office visit, and then a complaint or what you're calling about. And then once you submit this is sent to a laptop that one of the advanced practice providers here at the hospital will have. And then we can review what you need taken care of at that time. We can pull your chart up so we can have an intelligent conversation as to what's going on and give you some direction on what we can do from there, whether we need to do a close follow-up or do we need to hold a medication for a short period of time, or do we need to have you go to the ER? I mean, it can go the full gamut. And then there is also a number on the website that will call directly to the advanced practice. But the caveat with that is the phone is being carried by somebody who's in the hospital actively seeing patients. So if it does go to voicemail, we will call you back. It has caller ID, and you can leave a message as well. So, and I think the MCI patients are having mailings sent to them, and we just recently posted the information in the newspaper. So we're getting the word out that the line exists, and we're just looking forward to the patients partaking in the line.
And I am so optimistic about the amazing unlimited resources going to be here on Monday of the Cleveland Clinic Foundation, the abilities for this, the digital technology and the artificial intelligence. We did this locally, this is the stuff, it's our effort to try to do this as a part of the patient out of the hospital. Is as innovative as opening the coronary artery inside the emergency room. Because we open it fast, there is less damage to the myocardial. So we don't see the patient coming to the hospital so often with heart failure. If we open the artery early, the amount of damage is so small that they don't get heart failure from cardiomyopathy. Actually, the number of patients with ischemic cardiomyopathy means heart failure because of damage in the myocardium. It's probably the least I ever saw in any other place I've been. And currently talking to my colleagues, that's part of it, because we open the artery early, you stay in the hospital a couple of days, you go home. Even in TAVR, for 5 years, when we give the patient new valve, we talk about this before, I sent them home, same day. And now in COVID time became so attractive that you don't stay in the hospital long, let me fix your issue and go home. Just, what we do. So I'm hoping the technology will be more easier to the patient, more accessible, and as Dan said, we may be able to have like face-to-face with our patient. It's not an easy task, but I just heard it today in the board meeting just before I joined you, there is 50 million or so many millions of dollars committed for adopting an amazing digital technology to help us conducting our mission towards the heart.
Okay, our last break here, listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy on News Talk 1480 WHBC.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Yes, we are open. We are open. The Medicine Center Pharmacies and the Half Off and Out by store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
We are back. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you with me, Doctor? Okay. How do physicians in the advanced practice team work together to provide complete patient care during COVID-19?
That's a good question. Like I mentioned before, advanced practice are part of the entire healthcare team. In the hospital, we have an acute care side, we have an office side. So oftentimes throughout the day, we'll get consults and we'll be the first ones to go see the patient. We'll get their history, do exam, get a treatment plan in place. And then we'll talk to the doctor, cardiologist, see if there's anything additionally they want to do or if their treatment plan might differ from ours. And then in the office, same thing, we'll have appointments set up with patients, we'll see them independently with the physician's reviewing our charts, and then if we need to have discussions with the cardiologist about current situations with the patients, we can do that. But it's an entire team that takes care of the cardiology patients. It's not just cardiologists, not just advanced practice. We have to work as a team. We have to communicate.
And let me tell you, just as if we can focus into how is the process of creating doctors, how is the training of graduating cardiologists from training programs in university. When I was in teaching, how did I train my fellows to step out and go into a community or wherever, and they are heart doctor to deal with heart patient? It was experience of exposure to the patient. So the doctor will see the patient first, exactly like what Dan said. So if you are a fellow in a training program, a consult to cardiologist, the young doctor in training will go see the consult and examine the patient and come back to the teacher who were us attending and tell us what he think and what we should do, and they discuss it, and they will go examine the patient, agree, disagree. And during this process for 2-3 years, when he's done, he's in his own. Now the way we are working with our nurse practitioner and the physician assistants, they are like the super fellows, because you work with them year after year after year, and they are still here. So don't get surprised that a lot of them, it's like you instead of having 2 or 3 years of communicating with a senior doctor, they have much more abilities and experiences. So we value our investment on them. Why I was in teaching? What really make you effective doctor? 3 things. The intelligence, which you read about, and they are not lacking this intelligence. They are all intelligent. And the second thing is experience, because the evidence-based medicine, as you all know, is probably less than 20% of what we do.
Okay.
So
guess what? We're almost out of time.
Oh,
we need another hour, okay?
As usual.
To talk about this. So, Daniel, how about telling us real quickly how we can learn more about Heart Hospital at Mercy Medical Center?
There's information on the cantonmercy.org website, and it will be under the Mercy Cardiovascular Institute tab, and then it'll give the patients information on the Heart Hospital and our services provided.
Okay, very good. Thank you very much, gentlemen. Thank you to our guest, Dr. Ahmed Sabe, Executive Director of the Heart Hospital at Mercy Medical Center, and Daniel Harvey, Physician Assistant. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, our technical producer, JT DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC. Thank you very much, gentlemen. Thank you.
Thanks,
Thank you,
Paul.
Doctor.
Thanks,
Daniel.
Medicine Center Pharmacy
Thank
on
you.
News Talk 1480 WHBC.